Hi, good afternoon, coaches. Welcome to today's e-workshop series. All right. In this fourth segment of the four-part series on sport first aid and injury prevention for coaches. All right. Today we'll be focusing on the principle of injury rehabilitation and the important role that coaches play to ensure safe return to sport after injury. This is the continuation of last Monday's session where Ms. Yo Hui Kun, who is our senior sports physiotherapist from SSI, who shared with us coach's role in acute injury management. All right, so today she will touch on the coach's role in injury rehabilitation. All right, over to you, Hui Kun.
Okay, thank you. Hello, good afternoon. Okay, let me share my slides.
Yep.
Okay, so today is my last part of this series on sports first aid and coach role that you play in athletes' health. Okay, so today we're focusing on injury rehabilitation, where we cover quite a big part of acute injury management last week. So just a recap of the slides that we did cover previous series. We covered injury prevention. We also look at the different type of injuries. Last week we looked at acute injury management, and this week we're going to look at monitoring and adequate assessment and treatment of rehabilitation of athletes' injury. All right. Now, so for this afternoon session, we're going to cover the principles of injury rehabilitation, but also we're going to talk a little bit about the criteria for safe return to sport. Okay, so let's take a scenario where you have an athlete, while participating in your activity or your training, okay, and this athlete just went into an inversion sprain, had quite a big amount of pain, and we determined that he or she has actually sustained an ankle sprain. There was swelling, and then there was difficulty moving, and that you have provided an acute management, and that this athlete went on to sought medical help, right? And then doctors, it could be seeing a doctor or it could be seeing a physio directly. And with that, everyone is established that there is a tear in your ankle ligament, and that the advice was, let's start with acute management, looking at resolving symptoms like your swelling, because there's pain, there's swelling, you've got difficulty walking. Okay, so this is pretty straightforward. However, a big concern is what's after next. What happens after you resolve your pain, and what happens after the swelling has settled. And this big portion, okay, plays a very important role, but it seems like a lot of people actually have overlooked on the rehabilitation portion. Okay, so just some misconception about injury recovery and return to sport. So one of the biggest myth or misconception is that after sustaining an acute injury, right, you just need to rest, wait for it to recover, and you can actually go back to sports or return to sports after that. Right, this is actually a big misconception, and we will actually explain a little bit more in the later part of this workshop. Okay. The next misconception is that as long as all my symptoms resolve. So what we mean by symptoms is things that you can feel. So you will have pain, you can see that you have swelling, and you have some difficulty in walking because of the pain, and that by pure resting and slight medication, for example, or some intervention, you more or less can resolve the symptoms of pain. The swelling, even by not doing anything, would be likely to resolve in a week or two, right? And that's all the other, and because if your pain has got better, your swelling has resolved, you tend to walk better. But with this full symptom recovery, a lot of people would think that you have actually fully recovered and you are ready to return to sport. So this is the second misconception, right? And lastly, the third misconception is that, and a lot of time coaches, when they come to a situation whether athletes should return or is not ready to return, and they totally rely on medical staff or the doctor or the physio to say that they are ready to get back or they're not ready to get back. But the problem is that the point of you're ready to get back and the understanding and the interpretation of ready to get back to sports, it's very different. So in the medical context is that you are ready to get back. In a way, what we're trying to say is structurally, in terms of structure, in terms of soft tissue, healing is in a process, you are completing the process of healing. And the next phase is to get back your function. And with that, you more or less require a gradual return. However, from the athletes and the coach understanding perspective, because the doctor says that you have healed, a lot of time the interpretation means that I can go back to full return to sports immediately. And usually this is a case where risk happens and re-injury happens, right? So let's take, for example, the ankle sprain again, because this is a very, very common injury. So, when you sustain an ankle sprain, this is what it looks like. You get swelling, and at times, if the injury is severe enough, you get a lot of bruising, and you get, so on the symptoms basis, you get pain, you get swelling, okay, there is, microscopically, there is tissue damage, right? But on the other hand, other than symptoms, there are a lot of other problems that will result in this ankle strain. Because of the tissue damage and because of the pain and the swelling, it actually results in two other problems. One is your physical impairment, and the other one is your functional limitation. So your physical impairment will include things like, because of the swelling, it limits your range of motion. So you have decreased range at the ankle. Okay, you have some weakness that could be coming from the pain inhibition, but also from weakness from the structural damage itself. And because of that, there is also the altered motor control. So the way you control your ankle, because of the pain and because of tissue damage, the way you control your ankle will be different from how you control your ankle in a normal situation. So with the kind of limited range of motion, with the weakness, with altered motor control, then what you get is, in terms of looking at your function, it will affect your movement. So you get things like joint instability, you get difficulty, you slow down and you get problem in change of direction, you get problem with functional movement like jumping, running, pivoting, and in fact, landing from jumps, right? So if this is not addressed, then, even with resolving of your symptoms, it is very likely that you're going to, the risk of you re-injuring yourself is high. And we know that in our very first series, we talk about one of the biggest determinant of injury is your previous history of injury and the lack of adequate rehabilitation of that injuries that put you at very, very high risk of re-injuring yourself again. Okay, so what do we actually need to understand is this whole principle or whole phase of sports injury rehabilitation. What are we trying to do when we talk about injury rehabilitation? Okay, that everyone needs to understand that this is a dynamic process. It's not a magic pill. It's not just one equipment. It is a holistic management with looking at a few variable factors that you put into this basket to actually consider rehabilitation. So it is something very dynamic, but at the same time, it is very structured process. Okay, so it aims to, one, restore your athlete's function and performance level, right? At least back to your previous level. And if you do it correctly, and if you identify, if you and your medical team identify some of the injury risks, in fact, you could restore the injured athlete's function and performance level better than the previous before their injury. The other aim is to return the athletes to sports participation in a safe and very timely manner. Okay, depending on the severity of the injury, this whole rehabilitation process can take from a few days right up to a few months, and at times it could take up to a year or so. Okay, and so within this process itself, we need to understand that it is a very dynamic progression. So it is not a program where you do it for 6 months or 9 months. It is a very dynamic one where you see a progression of your program and your rehabilitation content in a week or in every few weeks, or in fact sometimes in a few days. And the aim is also to minimize the risk of re-injury. Now, so let's look at the principles of injury rehabilitation. We actually break it up into 4 different phases. Now, you may Google about injury rehabilitation, and that there are some that provide, some of the websites that provide you with injury rehabilitation, as in there are 3 phases. Okay, but in a sports setting, we actually go a phase beyond the 3 basic phase, which is phase 1 is acute, phase 2 is restoring activities of daily living. The 3rd phase is to return to sporting activities, followed by the 4th phase of addressing re-injury. Okay, now what does acute phase means? Acute phase, okay, the phase within this phase itself, we actually focus on resolving symptoms. Okay, and the aim is also to facilitate whatever it is to help with healing. So this is where the peace and love actually applies quite widely within this acute stage, right? Take for example, a day or immediately after you had sprained your ankle, and if the physio or doctor had seen that ankle, it tells you that, look, you have actually torn your ATFL or your ankle ligament, for example. And this is what we're going to do at this acute stage. We need to actually resolve the symptoms, and we need to create a good environment for healing to happen. And what we could do is what we learned last week, to apply peace and love, right? Looking at educating them to say, okay, we can use your crutches, or you can use a knee brace to protect that injured ankle for a few days until your pain get better. Try to alleviate as much as you can, avoid anti-inflammatory modalities, do your compression. You need to educate your athlete, or we need to educate our patient to say that, okay, this whole process, I'm taking you through this whole process step by step, but there is always an objective and a milestone to achieve within this whole process itself. So the education will be very important, because that can actually manage their anxiety and their expectation. And also it is a time where we actually educate them about the perception of the whole injury rehabilitation outcome, right? So of course you need to encourage them to actually keep some optimal loading, stay optimistic, and then, do your pain-free exercises as tolerated, right? So then when you reach those milestones of having decreasing pain, okay, decreasing swelling, etc. Then the next phase we look at is to aim to restore activities of daily living. So what does activities of daily living means? Is your basic movement function that define you as a human being. So things like able to stand without pain, able to walk, able to squat, able to go up and down stairs without pain. So how do we actually address this? It is looking at working on more targeted exercises to, for example, increase range. So this knee to wall exercise could be something to actually help you to help the athlete to increase their range of motion or the ankle, right? We could be doing some targeted exercises like using TheraBands or using body weight, okay, supported to actually strengthen the affected structure. Okay, it could also be something to involve balancing, okay, because we know that altered motor control, because of the altered motor control during injuries. And what we're trying to do is eventually using such targeted exercises to actually address, to restore your normal function. Things such as walking, brisk walking, stairs, squat, etc. Right? So now, one thing is that once you achieve this exercise, in order to achieve this, it has to be graduated. So graduated in a way that you want to graduate a few things. Okay, you want to graduate load, you want to graduate duration, you want to graduate the difficulty of the exercises. So if you look at this slide itself, okay, it looks at a phase-by-phase progression of your program. So you will see that within the initial injury period when you enter acute management, and then followed by the phase 2, within phase 2 itself, there is a lot of things that we address, right? One, increase your tissue load tolerance, okay, by giving you some targeted exercises. For example, we address biomechanic issues like at times, based on our assessment, we may say that, okay, it's still painful with single leg stand, or it's still painful with single leg heel raise at the ankle, and that let's work on something, exercise. Let's put in some exercise, or let's look at what is causing you to actually still continue to have pain, or just issue of not doing your single leg stand or single leg stand on your toes, right? And then the next component is to also maintain general condition. So what we mean is that if you actually sustain a severe ankle sprain, you're likely to be out for a period of time. And how do we actually still get you to maintain your cardiovascular fitness, and how do we get you to actually maintain your strength in the other part of your body? Okay, do I give you some targeted exercises for your hip? And do I give you some targeted exercises for your upper limb? Do I still be able to give you some exercises for your core, etc., etc., right? And then you would likely to be able to, once you meet a few milestones, you would likely to be able to progress to the next phase of sport-specific rehabilitation. However, with this slides, you would just see that the amount of involvement is like in phase 1 and 2, you get a medical team which is more involved in the whole rehabilitation process. But as you actually goes into phase 3 and even phase 4, it is no longer just the medical team's involvement, or we wouldn't say that we wash our hands and say it's not our purview. It will become a combined effort of responsibility in terms of being between the medical team and also the coaches, because you played a part in terms of when we try to get our athletes to go back to sport-specific training. The coaches would play a big part in the involvement of this process, and we'll talk a little bit about your involvement later, right? Okay, so on this, one of the things that you need to take away is that everything has to be graduated. Graduated in terms of load, graduated in terms of difficulty, graduated in terms of duration and impact, right? And what we usually do is that we don't just go and follow a recipe or follow just a program blindly. So with this whole process of graduated, it's also based on assessment and based on some form of goal setting. So you would see that, when we address range of motion, you address motor control, you address muscle strength, there is always a target that you want to achieve. But with that target, we set a few milestones along the way, and that you also implement some tests to see the effect of this whole rehabilitation program. Okay. By doing so, okay, we not only put the athletes in a safer progression, it's also a way to build their confidence and let them understand about this whole thing about injury, recovering from their injury. Okay, so then if we have meet all goals, or we start to meet more milestones and goals within phase 2, that's where we start to prepare our athletes to go into their phase 3 of their recovery. And with this, what we're doing is to prepare the athletes to return to their sporting activities. Okay, sporting activities will be the sports that they are participating. We know that different sports activities will have different demand, and that this whole rehab program will have to take into consideration on the sports specific activities, right? So within this phase of returning to sports activities itself, we actually break down into 3 subgroups of returning to sports activity. So first of all, we would look at returning to participation, followed by returning to sport, and then lastly is to return to performance. So what does this mean? So it is basically looking at an athlete whom with an ankle sprain that we have addressed the range, we have addressed the strength, we have addressed the single leg balance, and that they have reached pain-free ADL. So they reach pain-free going up and down stairs, they reach pain-free walking, they reach pain-free squats and other normal activities. And we will start to include very sport-specific activities. So one of the most basic sporting activities would be things like, for example, running and sprinting, followed by jumping, followed by quick change of direction, for example, right? So this is where we put them into this is where we will consider that as a sport-specific movement. So which means that when we say that you're ready to return to participation phase, means that the training it's considered restricted. So which means that there will be likely a big portion of the training activities that this athlete may not be ready to participate, but there are some simple activities that the athletes could start to participate in. So this is where we work with the coaches and say, Coach, for the next week's training, we are actually putting the athletes to return to participation. Training has to be restricted, and the advice for the training will be provided. So we say it's that restricted training in a way that we're meaning is that based on this athlete, it's like we tested the athlete in the clinic itself that they are ready to start jogging, straight line jogging. So for this week's training, the focus should be 1, on straight line jogging. And for example, if it's a netball athlete and says that maybe this is the amount that we want them to do, straight line jogging, we'll provide the speed or the volume that's required for jogging. And that says that maybe for the rest of the training program, what the athletes can do is maybe static upper limb activities, like for example, shooting or passing without movement, without change of direction. And slowly, we may actually include sport-specific drills. So for example, again, when we say it's a netball athlete, what we'll do is that, okay, this athlete has been able to tolerate straight line running without major problem. Let's progress her to straight line jogging, straight line running, which varies the speed of her run. And that maybe the next progression would be that let's do interval run that incorporate a change of direction in terms of running. Okay, and so this would be slowly progressed to maybe side to side. So instead of forward and backward, now we are combining side to side movement, right? The last thing that we want to do is actually doing pivoting, followed by jumping and hopping activities, which is more dynamic. So this is what we call sport-specific drills. And eventually, if athletes are able to progress with that, the next thing that you want to look at is, okay, can I combine that into some targeted training? So this is a time where maybe this athlete would be able to train with the team a little bit more, but not completely. So that's where we plan some safe targeted training. For example, just warm up. During warm up, we can do some passing with running, but there is no contact play at this moment for this athlete. Okay, so these are the progression where once they reach the next milestone, that we would eventually then look at, are you able to participate in a full training? So when we talk about full training, means that there are drills that the athletes are doing, has to achieve, but at the same time, they need to start to do some contact play with the teammates. Okay, and that with this monitoring, that if there is some issues, maybe that's where we can review it and say that, okay, maybe we have progressed her too fast. Could we actually take a step back? Versus someone said, this person is doing quite well. Let's just continue monitoring and that let them tolerate the activities and the load a little bit more before we actually progress the training intensity or the demand of the training. So it is only when athletes can be targeted, can actually complete a full training at a period of time. So what we're not saying is if he or she is able to complete a full training, means that the athlete is ready for competition. You most probably want the athletes to be able to tolerate, repetitive and tolerate some repetitive and consistent training to actually see whether there is that endurance, that the athlete could actually cope with the consistent or the increasing amount of intensity and impact before you look at targeted competition. When we talk about targeted competition, it means that you're looking at that. It's depending on the type of sport. So take, for example, badminton would be to say that, it's okay, I just want you to start playing, okay, a game, a match with such a strategy. The aim is to finish a full game. The aim is not to win for this targeted competition, right? And eventually, when we monitor and progress it, that when these athletes achieve your targeted competition goal, that's where the full competition participation can be considered. So this whole return to sports activities, is actually a gradual progression from just to return to participate to return to full sports, to return to performance. Within this subgroup itself, you're looking at restricted training, eventually going to unrestricted training, and therefore slowly progress to partial or full competition playing time, right? So everything has to be graduated, and as I said, in terms that we need to take into consideration, not just by saying you need to graduate it, but be graduated, but you need to actually look at the outcome of this whole graduated program. Is the athlete coping very well? Is he or she still having difficulty, having pain? Is there still weakness that you notice, etc.? And then, start to review and reassess again. Okay. So, and then the last phase itself is that when you get back to full training and performance, that's where you also start to look at injury prevention. And we know that injury prevention can have many different factors and many different strategies based on the type of injuries and the type of sports that you play at. And also there is the intrinsic and the extrinsic risk factor of the individual athletes itself. So with that, we basically have to draw up an injury prevention program. Okay, so with that, it more or less gives you an understanding that after your injury, right, other than managing your swelling and your pain and your initial difficulty in your movement, if we all overlook on not addressing the physical impairment and the functional limitation, then this whole rehabilitation is not considered complete. The risk is that athletes will have very high risk of re-injuring or sustaining another injury. Okay, so with that, are we happy to say that if an athlete had gone through from acute phase to the return to ADL, return to sporting activities, and are we happy to say you are fully, you're fully safe to return to sports? Okay, or is there other criteria that we need to take into consideration? Okay, so one, okay, returning to sports. When we talk about returning to sport, is how safe are you to return to sports? How ready are you to return to sports? On a side note is that, for certain conditions, like things like concussion, head injury, or some other medical problems, okay, if we do not take the return to sports criteria very seriously, are we getting ourselves into some medical legal issue, which means is there a malpractice, all right? We need to also consider medical ethics. Okay, this happens where, sometimes you say that you had, short of time because your athlete's injured 3 weeks before a major competition, and they just have enough time to resolve their symptoms. And that's pain-free, but the question is, do we push the athletes to skip the rehab process just because the competition is tomorrow, or do we have to ensure that the athlete needs to go fulfill full reconsideration, full injury rehab in order to be considered ready to return to competition? Okay, all this has medical ethics, ethical issue involvement, right? I would say is that in this criteria to return to sports, okay, when coaches, you're working with more high-level teams, this area of returning to sports become very unclear or become very complicated in a way because of other consideration. However, importantly is that one of the things that you need to be very sure it is that at the end of the day, safety is one consideration, important consideration, functional skills is another consideration, and that, you know, whatever it is that the condition do not get worse with high level function or skills, right? And that the decision should not actually put the athlete at risk of more injury. So when we talk about return to sports, it's also two areas that you consider. The on-site returning to sports, which means that it just happened right in front of an injury happening right in front of you, that we do a quick assessment to see whether they're able to actually go through functional tests normally, or it is a return to sports consideration following an injury or following a surgery. Okay, now, and there are many components that we need to take into consideration other than fulfilling the whole injury rehabilitation process. Okay, is there optimal tissue healing? Is there pain-free range of motion? When you stress the athlete, when you put the athlete back to training, has there been any persistent swelling, for example? Is the athlete able to cope with strength and endurance, right? Are there good flexibility? Do they have good coordination? Are they, adequate cardiovascular fitness, which means that during this whole rehab and injury process, did they lose their fitness, or did they lose their strength, endurance, etc., etc.? Did they lose their skill? Because from sports to sports, it's different. Within gymnastic itself, the skill requirement will be extremely different from, let's say, a 100-meter sprinter, right? So, and that we also need to ensure that there's no persistent biomechanical abnormality. So, for example, would be that, there is no issue about instability with the ankle, right? Also one of the very important consideration is athlete psychological ready. The psychological ready, it is not about, yes, I am ready, all right? Psychological ready, it is about that, how much the athletes know about their injury, they know, how much do they know about their impairment, and are they aware that, that about the risk of injury, right? So it is to also keeping them well informed about their medical problem or their injury. Lastly is, are you satisfied with their training program? Are they coping from a returning to sports phase, by monitoring their training outcome? Are you satisfied with their coping with your training program? Okay, so these are the things that you need to consider beside them having to go from one phase of rehabilitation to the other. Okay, so this whole thing, this slide shows you the sequential things that we have to consider. Okay, and a big component is about the testing during the return to sports activity phase. Okay, looking at fitness, looking at skill restoration, and also looking at strength, and looking at how well they are coping with training. And this is not just about eyeballing. This is getting a subjective feedback outcome. It's also trying to implement some tests to actually test your athletes out. Okay, and it is only when you see a progressive improvement in their performance, that's where we can actually put in a consideration that says that try to help you to determine whether athletes is ready to return to play or sports. Okay, so this return to sports criteria can be quite complex, but it can be quite straightforward also. All right, you need to look at all that different components. You need to, at times, depending on your resources, okay, you may be a coach at a school level where your athletes may only see you or train with you for three sessions a week, as compared to you being a coach in a national youth development team where the athletes train with you on a daily basis. Such difference actually will give you would have to set different realistic goal. So you would likely not be able to see a substantial improvement as much in the national development group versus your school as compared to your school athletes, because of the frequency of the exposure, and also because of the component of the training itself. Okay, the next thing to consider is how serious is this medical complication? You know, is that an injury that had to undergo a surgery, or is this just a mild injury? So the outcome and the expectation, the time frame is very different. Okay, and at the same time, sometimes for certain injuries, you know, we have also very limited evidence on prognosis. Okay, take for example, you know, some of the more complicated injuries like hip injuries, for example, or some of the shoulder injuries, and maybe some of the cervical or the neck injuries. You know, there are times that we do not have enough evidence to make sure to prove that, you know, the prognosis of the rehabilitation is good, and that, you know, we have to take into a lot of your criteria into consideration. All right. So next thing is then, you know, the assessment of return to sport criteria. You know, how much do you want to put into this basket of tests? Okay, importantly that we need to consider is skill, strength, fitness, okay, and how well they are coping with training, and that there is this others. Okay, so what does others mean? Okay, we'll talk about that in the next slide, but looking at this slide, we need to consider when you assess for the criteria for return to sport, right? You need to consider time frame, the stages of their healing, and the sport specificity. Okay, the assessment could be things like your symptoms, your functional test, your sport specific test, or your skill test, right? And then, okay, the others that you put into consideration would be the social factors and the psychological factors. Okay, sometimes do they have the anxiety? Are they optimistic, or they're pessimistic, or is that they still have some fear? Or maybe, you know, the social context or the social factors may play a part in them not getting ready to return to sports. So these are some of the things that we would have to reconsider before we actually looking at the functional performance and returning to sport. Okay, so when we put everything together, at times, please be prepared that, you know, when you put this athlete back to a phase of rehabilitation, the outcome and the improvement and outcome may not be very linear. At times, you know, you may see that they're going very well, but then, you know, when you start progressing them, they don't seem to be able to cope very well, which is fine. That, you know, just take a step back, because, you know, this is a whole rehab phase. The whole rehab phase means the injury is not fully 100% recovered. So things may happen as long as we reassess and we make modification and just help the athletes to get back slowly and gradually, right? And a time, you know, this whole rehabilitation phase is that you also need to consider that while tissue healing is happening, okay, the fact that when we stress the athlete, it also put the athlete at some risk of tissue damage. So we got to balance that up, the tissue healing and the tissue damage up. And that's why we say progression is important. Okay. So with that, the decision and the effort, the decision of returning to sports, it can start with medical team telling, you know, giving you a bit more information about the tissue healing portion. But it should not be stopped there, because the coaches, athlete, and if you work with a team of scientists, everybody do play a part in the contribution and the decision of returning to sports, the consideration for returning to sports, because we all have our background, our professional training that contribute to that. Okay, so it could be that it is coach, athlete with a medical team if you are working in a school setting, versus in a national team where you have a lot more support, right? Then the whole decision-making team will expand. Okay, so then now answering that misconception, then, you know, the myth is that rest will lead to recovery, but it doesn't lead to ready to return to sport. Okay, this is busting the myth that the fact is that with rest, okay, the rest do not address optimal loading and other factors of recovery other than tissue healing. So this, if you know that relying on stress, on rest and recovery only will predispose an athlete to re-injury risk. Okay, the next one is that when you have pain-free, you are pain-free, you have no more swelling, okay, you have no more pain in your movement, doesn't mean that you're ready to return to sports also. Because if you do not address the functional limitation and the physical impairment, you're going to put the athlete into a risk of re-injury again. So symptoms recovery is not only the first step, it's only the first step of rehabilitation phase. It is very important to address full functional recovery, right? And lastly, the misconception of medical staff is solely responsible for deciding returning to sports criteria. Okay, staff, it's a safe return to sports is a collective decision between medical staff, athlete, coaches, and other members of the team. Medical staff can be the first to contribute to the criteria of recovery, return to sport, but they are not the solely person to decide on the return to sport. Okay. Now, so what are these implications? The implication would be that coaches, you play an important role in to ensure that athletes get adequate injury management, okay, and that they complete their injury rehabilitation by completing their injury rehabilitation, okay. You play a role in preventing the worsening of the condition or injury, because you play a big role you have a big role to play in planning your athletes training program in a graduated manner, right? And also you are the one that can reinforce your athletes to fully abide by the gradual return to training and gradual return to play phase, right? And that you also play a role in deciding and planning how you graduate the athletes return to full training and competition. You can always have the freedom to modify your training plans based on the outcome and the phase of these athletes' recovery. Okay, you don't have to be very fixed with your training program. And lastly, you play a big role in injury prevention. Why is that so? Because as long as ensure the completion of the injury rehabilitation, and that you take into consideration all aspects of return to sports criteria, you can also reinforce with injury prevention strategies, right? So lastly, point to note is that, you know, you may not be the one that will come up with an injury rehabilitation program, because you are not a physio, you're not a doctor. However, you know, you play an important role in working with the medical team, okay, or working with the physios to ensure that athletes receive adequate assistance in the injury management and rehabilitation, You also play an important role in guiding the athlete's safe return to sports with the assistance of the medical staff, support staff, and you play an important role to reinforce that the athlete comply with a good rehabilitation program, right? So with that, I end my session by just reminding everyone that your role, you play an important role within the health of an athlete by having a role in injury prevention, injury recognition, first aid care, which is your acute care management, and that you also play an important role in the injury rehabilitation and the criteria to return to sports following their injury, right? With that, I end my session and I'll just open for question.
Yep, thanks, we could. I think before we open the floor for Q&A for those who are in this Zoom session, maybe we'll take some questions from Facebook. Right, there are a couple of questions. So one would be, because you mentioned earlier on about some functional tests that you did with your teams. So
Yes.
would you be able to share some of these tests that you have done with your sports teams or athletes?
Okay, so last week when we say on the field we can do functional tests. So some of the functional tests would be things like hopping, running, skipping. But functional tests would be in terms of when it goes to injury rehabilitation phase, it can be slightly more specific. So let's take, for example, this case where we talk about ankle, right? So ankle-wise, we know that once you have ankle sprain, you have issue with ankle range. For example, there will be decreased ankle range, you get decrease in balance. You can affect, your balance is affected. Your heel raise strength is also affected, and the other one is your inversion eversion strength that's affected. So these are some of the things that, if you are at a phase 2 of your rehabilitation phase, I will most probably get you to just do are you able to invert and evert pain-free? Are you able to invert and evert through full range, for example, and it's pain-free? And that, are you able to invert and evert with resistance, with my resistance? So these are simple tests that we put across. If it's that you want to see if they are ready for to enter rehabilitation phase in returning to sports, for example, then you could actually do simple tests. For example, are you able to do single leg? How long are you able to do single leg stand? How are you able to do single leg stand in a very stable manner, or there is a lot of sway, for example? Are you able to do heel raise, full range, pain-free, right? You want to actually progress it to something more dynamic. Are you able to hop and jump double-legged, followed by, are you able to hop single-legged? Okay, so these are some of the basic functional tests that we do. But of course, for physio and the doctors wise, there are a lot other tests that we can do. You most probably hear about things like your Y balance test, for example. Some people may go into looking at what we call a 6-meter hop test, okay, at a more advanced level. So these are some of the tests that what we put across. But for coaches wise, it is very simple. That if it's a lower limb exercise, for example, lower limb injury, the most basic thing is, are you able to run straight line? And then are you able to run forward and make a turn back, right? And then are you able to go side to side, move side to side? Okay, are you able to run and change direction? So these are something very simple. And then you go on to the next phase where it is something like hopping, double leg, followed by progression. So we will talk about all these functional tests. We can talk about this all. There are so many of it that we can actually talk about it 3 days, 3 nights. Very importantly, it is knowing, working with the medical team, or even sometimes with the strength and conditioning coach to actually come up with something very sport specific for you, right? And that if you do not view it, and it's also a learning process where you start working with the medical staff in terms of hearing their concern and letting you know about the safety portion, and that eventually it is for you to pick up all the skills about having to test your athletes. But of course, you're not going to take over the role of the physio or the doctors who says that you fully recover or not. Your decision to do the test, your outcome of doing this test is to decide whether the athlete is ready to progress to something, a next phase of your training, which involve more difficulty, more dynamic movement, or it could be involving more load and capacity, etc. Right?
Okay, thank you. One more question. So you mentioned about completing all the 4 phases of rehabilitation, right, before
Yes.
going back to competition. So what if the athletes or parents insist on returning back to competition? So how would you? How can a coach advise them?
Okay. So again, I think once is a communication and a awareness issue, because I think in a phase where if you communicate well enough with the athlete and the parents and says that my concern is the safety of this athlete, and at this moment, if the athletes can only be running pain-free but not able to hop and jump without pain, then they haven't even been able to participate in full training. So it always goes back to inform them that it is about the safety and the risk, and to say that it is not, I do not want to stop. I want to stop you from participation, but it is that from functional test itself, you haven't gone through the full rehab, you haven't been able to complete or to be able to perform every single aspect of the requirement of the sport, and that if I put you back early, you are at risk of further injury, and that impact on long-term performance. And I think the communication, it has to be very clear to the athletes. If you just say, no, I don't want, tomorrow you cannot play, without actually explaining this to athletes and parents, then of course there is always the doubts there. But if everything is being laid on the table and say, look, at this moment, with this with our training, you're only able to complete or to be able to cover this area. We have not done this and we have not done that. And I do see that you are not coping with certain things because you are still having pain. Then that already is a decision of not being able to put the athlete back to training. So at the end of the day, I think once it comes to training and competition, it's between the coach and the athletes. So even if, external factors, they should not be the one that decide the decision other than, the team that's involving with the team, because they are the one who had supervised and who had guided these athletes through their recovery phase itself. Yeah.
Okay, thank you. I'm mindful of the time, so it's 4:01 now. So maybe we answer another 1 or 2 questions.
Sure.
So there's a coach. Yeah. So let's say even if an athlete suffer a major injury such as a torn ACL, so after surgery and injury rehab, is he able to return back to sports stronger than before?
I think we have very strong evidence now that firstly, ACL itself, okay, when you tear ACL, even not all athletes who tear their ACL needs a surgery, okay? There are evidence to say that conservative management, there are quite a number of athletes that can actually be able to cope, all right, with conservative management without surgery. But of course, the other big part of a argument and big part of the information that we have right now, it is that even for athletes that go through surgery, right, the injury rate is high, the re-injury rate is high following surgery in a group of athletes. And there is big evidence to say that if you do not do your rehab, so which means your phase 3 or phase 2 and phase 3 of your rehabilitation process properly, so you do not rehab enough, you do not rehab adequately, so you did not do the right thing, you do not do enough, or you did not even do at all. These are the ones that actually have very high incidence of re-injuring their ACL again. On the other hand, we also have evidence to say that there are a number of athletes that can return to full function, if not even better, even without surgery. So the important portion here, the takeaway note is that the rehabilitation, whether having a surgery or not a surgery, okay, the rehabilitation is equally important to ensure that the athletes get better and to ensure that the athletes do not re-injure themselves again.
Yep. Thanks. So I think maybe one last question before we end this session. So how do athletes get access to sports doctor? Usually they will just go to GP, or if let's say they go to polyclinic, they'll get a referral. And this process takes very long. So in the meantime, what can coaches do while waiting for the appointment?
Okay. So I think if you look at the landscape of sports medicine now, there are some, there are other than sports physician specialists, I would say, which most of them in Singapore works in a restructured hospital in sports clinic. There are a couple of the sports clinic in private practice also. Okay. Other than that, actually, there are some GPs, okay, that do have a graduate certificate in sports medicine training. So which means that they are GPs, but they also have additional training in sports medicine. So you can actually have access to those services as long as you know who are these doctors that have that sports medicine certification. Okay, the other one is that for sports injuries, at times you don't need to rely to see a doctor first. Okay, if you see a good sports physio with the sports with very strong sports physio background training, the physios would be able to actually assess you on the problem and give you a rehab plan. And if there is a need, right, that the physio could refer you back to a doctor for consult. So that can actually decrease the time of your waiting. So I hope I answer your question. So it is a matter of, trying to find what exactly what are your available resources. If you are a school coach, right, there are some schools that do have a contract that ties in with sports clinic or sports physios, and these are some of those people that you can seek help also. Right now, the important thing is that doesn't mean that your rehab and your recovery only start by the time that you see a doctor. Right? If you want to shorten the waiting time, what I can suggest is see the sports physio first, and you actually will really shorten your waiting time. Right.
Okay. Thank you so much. Yep. I think it's already 4:05 now. So our apologies that we may not be able to answer all the questions. So perhaps after this, at the end, after this session, maybe we stay back for another 5 minutes to answer any last questions. So in the meantime,